Are you suffering with neck or back pain? Do you have a bulging or herniated disc?
At Disc Centers of America, we treat these conditions with gentle, effective, non-surgical spinal decompression and get you back to your normal activities.
You can avoid narcotics, risky injections, and unnecessary surgeries.
Get back to a normal, pain-free life.
Welcome to Disc Centers of America, where you, the patient, and your back is our #1 priority. We are here to serve you by providing you the latest of technology with the most updated research to provide you the quickest relief ongoing. Let's get you back in the game. Let's get your life back. I want to take this opportunity to again say thank you, and let's listen to what some of our Disc Centers of America doctors have to say.
The reason someone would want to go to a Disc Centers of America doctor is because these doctors are very committed. They're held to a higher standard. They have to have a certification from a national university. They have to pass a test. They have to pass rigorous training. The training is ongoing. When you go to a doctor, you want to go to the best. You want the latest and the greatest.
Since 2015, I was in such pain that I couldn't even walk. I would go to sleep and I would literally pull my hair from the pain. My back is really bad and my neck. Right now they're working on my back and it's been amazing. Since the day we came in here, I felt like I was in a place where they really care for people.
We change lives one back, one disc at a time, where we offer patients a non-surgical solution to back pain, to neck pain, pain down the arms, pain down the legs. Spinal surgery is now the last resort. The alternative should be non-surgical spinal decompression. Why? It's the safest, most effective treatment, most cost-effective treatment when it comes. The patient is the #1 priority. The patient must get their life back, doing the things they love. Why be invincible when you can be invincible?
The first time I came here, first of all, the staff is wonderful. They took me to a table, they had me lay down for my decompression, but they explained everything that was going on ahead of time, so I was not nervous. They are always with you anytime that you're on the table. They stop by, make sure you're comfortable. They'll give you blankets if you need it, pillows. The decompression is the most relaxing thing I've ever done. I have to thank Disc Centers of America again for giving me my life back. I can move, I can walk, I can ride a bike, I can do all the things that I hadn't been able to do before.
It's very important to properly diagnose a patient and have the proper treatment. If you have the proper diagnosis, you'll get the proper treatment. What so many patients that we see, most everybody that we see, probably 90% of the patients in a Disc Center of America doctor's office, they've been everywhere. They've tried everything. They're at their wits' end. They're tired of trying treatments that did not help them. They spent a lot of time and a lot of money. This is where a disc center doctor comes in. They are trained to see if you are a candidate or if you are not. And that is where the training comes in. That is why our training is ongoing. That's why we're dedicated and committed to research and getting a proper diagnosis. What I tell my patients is when you go to the doctor, and if they recommend some treatment, ask them specifically, how will this treatment help my disc? And if they can't answer that, you're not in the right place. What doctors don't realize is that disc has the propensity to heal itself if you get the water back into it. It doesn't have a direct blood supply, so that disc has got to have the water. That's all the machine does, is it pulls water back into that dehydrated, degenerative, bulging, herniated disc. It pulls the water back in, so now the disc has the nutrients, the oxygen, everything that it needs. So it sews itself up and it repairs itself and it stops bulging. And the results are long-term. It's such a beautiful thing. It's so simple. That's what I love, the simplicity of how this machine works, and how it works so well, and how it works long-term.
My back issues have just about totally disappeared. I've never had such great luck with my back, feeling as good as it is. It's really helped me in doing things that I wasn't able to do before.
Get right in, they get you on the table, they know what they're doing, they check on you, the doctor will come through and he'll talk to you while you're laying on the table. Just great. I mean, everybody did a perfect job. Wonderful staff and good place to go.
We are trained from day one that the patient is the most important thing. They should never be worried about coming to us about anything at all.
It's awesome. You just lay there, you relax, and then it decompresses your back. So, and that's what I needed. I need my vertebrae to get apart so they can start moving the regular way. They will do anything there is to be done to make you feel 100%.
What happens when you go to a doctor that's a Disc Centers of America doctor clinic? What's going to happen usually first is you'll come in and you'll fill out some basic paperwork. The doctor will come in and do a consultation with you. Most people have an MRI. If they don't have an MRI, we're going to need to get one. But most people have one. So what the doctor will do, he'll sit down with you and go over your MRI. He can even show it to you, answer your questions, so you feel really good about going to the next step. Then the doctor will typically put you in an exam room. He'll do a few tests on you just to kind of shore up what he thinks is going on. Then what most people do is they get on the table. You stand up, you get lowered down, they strap you in. Now that sounds like a lot, but it's very gentle strapping. It's very comfortable, and you keep your clothes on, and you're going to be on the table for about 30 minutes. And the table will gently pull and release, pull and release. And what it's doing is it's kind of like milking a cow. I tell people every time it pulls and releases, it pulls a little drops of moisture back into your disc that's dehydrated, that's degenerated, that's bulging, that's herniated. And it naturally pulls that disc back where it belongs. So you'll be on the table for about 30 minutes. No fear of it hurting, no fear of it making you worse. Once you get up off the table, we're going to put you in an area and put an ice pack on your back for about 15 to 20 minutes. And then a lot of doctors like to use what we call a cold laser. The laser is like a magnet to blood. What it's going to do is it accentuates the healing process, it takes down inflammation in the body, and it gives you that relief that you're looking for. And once you've done that, the doctor or the staff will give you a folder, and it's got very important information in there that you should read.
The experience of actually having the decompression treatment is very relaxing, really. I mean, you just lay down on the table. It doesn't hurt. You can feel the pull, but it doesn't hurt at all. In fact, lots of people sleep through it. It's very relaxing.
They want you to know and understand what your condition is, because then you can make a better decision on how to properly treat it. You don't go back down that road of pills, medications, shots, injections, failed back surgery. Those are all treating the symptoms. They're not treating the disc. And that's what Disc Centers of America doctors do. That's why we stand out, and that's why we are committed to excellence and the disc treatment of injuries. That's what we're all about.
He laid it all out for me. He told me what was going to happen. He put me on the table, my first decompression. It didn't hurt. It felt great when I got done. I went back for more treatments. I went through the whole entire regimen. I can't tell you the difference it's made in my life.
Patient care to myself and to my family of Disc Centers of America doctors means everything. We want the patient to get one thing and one thing only: results. We want you to feel better. We want the patient to get their life back, to go back to lifting your grandchildren, go back to playing golf, go back to doing the things you love. We care about our patients at Disc Centers of America, where the patient is our number one priority and number one concern. We continue to grow at Disc Centers of America for one reason: we care.
As a former NFL player, I've experienced multiple injuries. As a teammate of many athletes who were experiencing pain and possibly feeling diminished capacity to compete at a high level, spinal decompression was by far the best way to non-invasively, drug-free treat back and neck pain by far. The earlier detected, the easier corrected.
I couldn't move, I couldn't do anything, and I came here, and now I'm so active. It's just, I feel like I'm just almost back to normal, what I was before the accidents.
One of the key factors here is making sure that every patient understands that financial feasibility is never an obstacle to getting treatment. In other words, having the options that as Disc Centers of America doctors, we're able to afford our patients that make it simple, user-friendly, and really, really easy to accomplish what they want, which is number one, getting the treatment that they need, and number two, getting the treatment that they deserve. It's a win-win situation across the board. Our patients love it.
Well, I want to thank the Disc Centers of America, number one, for having it out where just about anybody can afford to have it done to their backs or to their spines.
My quality of life was very limited as far as picking up my grandchildren, doing housework, golfing, gardening, mowing. I had to take at least 4 leave a day, and after I came here, I haven't been taking a leave. My quality of life is back. I regained my youth, I regained my activities, and I'm sleeping so much better. Before I could only sleep a few hours at a time, and now I'm able to sleep all night long.
I've been able to do anything. We went to Florida last year, and I went out fishing in the boats, and we built fences, and we did about everything we wanted to do.
I sleep better. I wake up, I want to get out of bed. I don't lay there and look at the clock and say, oh gosh, it's only 7 o'clock. I'll just, go back to sleep till 9, in which I usually would. Didn't matter what time I went to bed. So I'm definitely resting better, which has also helped with my quality of life.
Thank you. Thank you for taking the opportunity to watch this video. We at Disc Centers of America do not take you, the patient, lightly. Matter of fact, you are our everything. We're changing the world one disc, one patient at a time. Disc Centers of America doctors are some of the most trained doctors in the United States on spinal decompression. Our clinics throughout the United States are focused on research from Harvard University, Johns Hopkins University, from the Mayo Clinic, even Stanford University. The best research, the best doctors trying to give you, the patient, the best results. So again, thank you. I want you to take this opportunity to sit back, relax, and know that you're in good hands with Disc Centers of America.
Disc Centers of America, a call to us can change your life.